Philippe, thank you very much for talking to us today. What, in your opinion, are the main challenges facing supply chain professionals at the moment?
Obviously, for me, the main challenge is the pressure that we've got on the cost side. It's quite clear that the supply chain function is one of the operating functions who has to help the company, of course, to improve the cost. Cost of distribution channel are getting more expensive every single year. So obviously, the entire supply chain organization and function is under tremendous pressure to basically find new initiatives to improve the cost. That's one of the key challenges we've got. The second challenge, of course, is the fact that those channels are changing a lot. We've got lots of pressure, especially on the regulatory side, lots of additional constraints, temperature control, regulatory constraints, which makes, of course, our job a bit more difficult. And at the same time, of course, we are trying to support the development of the business in emerging markets where the infrastructure is still not there, which is additional cost for us. And we have always to find solutions to make sure that we can push our products, of course, in those emerging markets with the right supply chain solution in terms of cost.
We were fortunate enough to have you as a speaker here at Logipharma this year. Tell us a little about what you spoke about and how the audience reacted.
Yeah, what I talk about basically it's the direct to patients. I think there is a added value, in fact, for the supply chain to try to provide different solutions. And one of the key solutions that we're trying to provide is basically to look at how can we support the therapy for the long term and go direct to the patient to try to provide added value to the patient. I think the key challenges for us is not only to provide just the right operational support. It's more than just an operational support. It's more a question of supporting a therapy and how can the supply chain position itself as a strategic partner to really support the therapy of the patient for the long term.
Obviously, you're a busy chap, but you've taken some time out of your schedule to come down here. What is it about Logipharma that brings people in year after year?
I think what's great about Logipharma is you've got, first of all, the network, obviously. You've got the key players of the pharma industry, which are here. And I think it's a good mix between supply chain providers, people who are really shaping, in fact, the supply chain for the pharma industry for the long term. And you could talk about various subjects which are very operational subjects, how to be more compliant in terms of temperature control, so technical subject, but at the same time strategic subject. How do you want to shape the supply chain for the pharma industry for the long term? And I think that really the balance is pretty good, and that's why I like it.
Philippe, thank you very much.
You're welcome.